Hello everyone, I am doing a live today with Elizabeth Carr, who is the patient advocate for Lifeview, which is part of Genomic Prediction, who do genetics testing. And she's also the world's first USA IVF baby, and I believe it was recently her birthday, so I'm looking forward to speaking to her today. Thanks to those who are joining. Thank you for the questions you sent in advance. I will make sure that we talk about them. There have been some really interesting questions around genetics and testing, when to have it, what you might have tested, why, etc. So I'm just going to invite Elizabeth in. Here we are. Hello, how are you?
Good, how are you?
Very well, thank you. Please introduce yourself. I've just given a very quick summary of who you are, what you do, and the fact that you are the first American IVF baby. So
That's right.
welcome.
Thank you. Yes, I am recently celebrated my 40th birthday as the first IVF baby in the US. So now everybody in the world knows my age. Not
Happy
awkward
birthday.
at all. Thank you. And I am also the patient advocate at Genomic Prediction, who produces the pre-implantation genetic testing platform called Lifeview.
Yeah, perfect. Thank you. So we've had some questions come through, obviously, around genetic testing. I'm going to ask you some of them, and if anyone who's joining has questions they'd like to ask Elizabeth, please do. First of all, really, what are the benefits of complete genetic testing? Why do people do it, or why are people recommended to do it?
Sure. So just for a little bit of context, when I was born, the technology was obviously brand new for IVF in general, and we couldn't really tell the health or quality of the embryos as we were looking at them. We called it like the beauty contest, right? Where we just looked through a microscope and said, well, looks pretty good to me. But now with pre-implantation genetic testing, we can really look at the quality of the genes. And so on the whole, a benefit, of pre-implantation genetic testing is on average a reduction in disease risk for that next generation. So it's really incredible that we can see those things now.
That is amazing. So do you get a lot of people coming to you for genetic testing because they might have some sort of hereditary illness that they want to check they're not going to pass on the genes, whether that's, I don't know, cystic fibrosis or something else?
Sure, absolutely. So obviously, a lot of people look into pre-implantation genetic testing because of that family history or background to potentially screen out. So it might be on the mom's side, that might be something that we can look for. It might be on the dad's side, or maybe you're both carriers, and you're not sure if it's going to present itself in the next generation. So that's a huge reason why a lot of people go through this. And another one is just, generally speaking, people want to give these potential children the best shot out of the gate. They've worked really hard for them and just want to make sure that they're mitigating any potential risks, really.
I understand. And also, sadly, for people who have experienced loss, whatever kind of baby loss, whether it's recurrent or not, may want to find out more about whether they're carrying a miscarriage gene. Is that right?
Sure. So, there's a lot of different reasons why people don't carry to term, right? So a lot of times it can be the fact that an embryo has an abnormal number of chromosomes, and that's a typical reason why people experience pregnancy loss. The timing of the particular loss depends on the severity of the abnormality, which again relates to the specific chromosome that triggered the reason they didn't go to term. So larger chromosomes will tend to miscarry earlier in someone's pregnancy, while smaller ones sometimes, carry later into the pregnancy, or even potentially result in live birth. So it all depends on, not all chromosomal abnormalities are, fatal. And that's really one of the other benefits of looking into this and seeing what is really going on structurally.
Yeah, it makes complete sense. We actually had a question come in, which I think I told you about before, and I know some readers have this and want to know more about it. It's translocation genes. and how that affects fertility. I know that we're not having a medical conversation here, but what has been your finding through Lifeview around that and testing for that?
Yeah, so full disclaimer, right? Like,
T18. Yeah, exactly.
right. So I'm not a scientist, but the best explanation I can say is that one of the special strengths of the Lifeview platform is finding those translocations. So, I can't speak to specifically the T18, but what we do is we require that parents have been identified as carriers for the specific translocation question. So in this case, it would be the T18. And then we set up testing with the parents to move forward so that we can, examine what's really going on.
And what might people find from results?
So, I mean, it depends on what kind of testing you're going to go
through. Of course, yeah.
So, but our reports, generally, we generate a report at the end where, once you get it, you can then circle back with our genetic counselor and they'll go through the results. Or obviously talk to your clinician as well.
So I guess this is another question. At what point would people come to Lifeview for testing that they wouldn't have in their own clinic, for example?
Sure. So again, this is one of those when you're going through the process with your clinician, it is a conversation of, what you're looking for when it comes to what type of pre-implantation genetic testing, because there are many different types. So for example, if you're going to do PGTM or PGTA or PGTP, those are the conversations you should have with your clinician first. And then, most of the time the clinician works with a specific lab. In this case, it's us. And so we really coordinate with your care provider to make sure we've got all the consents and records and all of those things. But, it's not an extra step. I think that's the most important thing for people to keep in mind, is that this weaves right into the current process that you're going through with your clinician. And then we work, you will go through genetic counseling, so you'll get a full picture of what to expect and what the process looks like. And we, pride ourselves on quick turnaround times as well. So, we really understand the process and that it can be, confusing and overwhelming and highly emotional. And so we work to streamline that whole process for people.
Fantastic. And so could you work with any clinic in the US or any clinic who do you work with? If people thought, oh, I would be interested in having a deeper dive into the genetics testing and it's not a panel that's offered through my specialist, for example, how can the patient advocate for themselves and get that testing in place through Lifeview?
Yeah, so we will, work with, as we always try to work with as many providers as we can. There's a full, probably not up to the minute list that's up to date on our website, but there's a very up to date list on our website. If you just look at our locations, so if you go on lifeview.com/locations, you can see who we currently work with. But then if you reach out to us and you say, I really want this test, if your current provider isn't working with us, we'll either work with them to, get them properly set up, or we can help you connect to somebody who is doing our testing. So, again, take that burden off of you in terms of trying to connect the dots. We will connect the dots for you.
That's really cool. Good to hear. And then just thinking about, we just touched on the benefits of complete genetic testing and why people do it. What about eggs being tested? Someone asked, would people have eggs tested versus having embryos tested, for example, and why would they do that?
Sure. So again, I'm not a scientist, but I really think that is a conversation. I can't offer specific advice there. That's a conversation you should really have with your specific clinician in terms of which pathway you're going to take. Certainly, you can contact us to find out the different tests that we provide and the different benefits and information that those results would give you, if that helps in making your decision. But obviously, it's one of those things that everybody, everybody's a special snowflake, so they needed to be treated as such. So,
And if people get back a result that they weren't hoping for, or it sort of uncovers something that isn't perhaps favourable. You mentioned the counselling that's part of that. What would people be given sort of other options? Where would that be through you guys, or would that be going back to the clinic for advice on next steps?
Sure. So essentially what we can do is go through your results with you and kind of explain, what we found. And then, we can work with your clinician to triage next steps or, anything like that. It's really, one of those things where every case is individualized.
Of course, yeah.
Yeah, exactly. Depending on what you need is what we will, move forward to do with you.
Because we've had some questions about costs as well, and I guess it depends what kind of testing you're having and all sorts of different things. It's very personalized care, isn't it?
Yes, it is. Absolutely.
What is the turnaround time normally?
Usually the turnaround time is about a week, so it's very quick.
Okay. And should people be worried about eggs or embryos being damaged?
We take the same little tiny, tiny piece that would be normally done for any standard, like PGTM, which has been done since the 90s. There's always risks involved, but they're extremely minimal.
Mm-hmm. Okay,
Yeah.
that's good to know. Is there anything else that you think people should know in terms of genetics testing or something? Any other questions that people have that they haven't sent in? Feel free to ask, because we were going to do a webinar, weren't we, before Christmas around loss. So I'm sure, and we had a lot of questions around genetics testing for loss. So my suggestion would be to reach out to Genomic Prediction directly to have further conversations for more of a personal approach to what you can do, I presume.
Yes, absolutely. And, while I might not be able to answer the science questions, anybody can reach out specifically to me from our website. Go on the About Us page, you'll see my name and my email. And one of the things I'm really good at doing is getting people the answers that they need. And so your note will obviously be ushered through by me to get you exactly the information that you need. So no question is wacky or out of bounds. This is a new-ish technology. As I said, PGTM's been around for quite a while now, but in terms of people's baseline understanding of it, a lot of people still need some education, and that's totally acceptable and wonderful. And so, I pride myself on there are no silly questions. Oh, and can you share your website with us? Yes, I can. It's
write it in the comments.
Yeah, that's right. It's in the comments.
www.lifeview.com. There we go. And I presume people can DM you on Instagram Messenger as well to start the conversation.
Sure. Yep. They can either go through Genomic Prediction, which I'm on right now, or they can contact me on my personal one, which is eJordan12. And you can tag me there as well. Either place. Again, contacting us via email through the website is also another vehicle. Basically, we'll answer anything except for a smoke signal. If so,
someone said,
answer your
question. When you did, it made me smile when you said you're quick to get back to people, because whenever we have email correspondence, even though I'm how many hours ahead of you, you always reply immediately, and I'm like, you should be sleeping.
Yes, I don't think I sleep very well, so it's a benefit to all of you.
Well, that's your role in terms of being a patient advocate, isn't it? Not the lack of sleep, but I mean empowerment and education. And so for even people to be able to talk to someone to get the ball rolling and just to understand for something that seems so medical and so scary, which is sort of like my aim, our aim too, to demystify that so that it's an easier process, less daunting. You can have your questions answered. No question is a stupid question. Then at least you can help join the dots and give people that support that's needed.
Yeah, and that's one of my personal crusades, not just with genomic prediction, but with any fertility topic in general, is to have people feel like they can ask the questions that they might think are stupid, because they're not, because they're not the only person that's had that question. And so continuing that conversation and asking those questions, you're not the first person to ask it, even if you think you might be. And so nobody should be intimidated. Nobody's going to be judged by asking a question or wanting more information. It's critical. This is your future family building. So ask all the questions in my mind.
How was it growing up knowing you were the first IVF baby in the States?
You know, that's always such a hard question for me to answer because
I get asked that a lot, sorry.
Yeah, but I grew up, it was just normal, right? So it was just my normal life in my family. Obviously a lot more media attention than the typical child. But, you know, I learned from a very young age that this was really important technology, and to not be afraid to talk about it, right? To keep those stigmas, you know, crushing them essentially by speaking up and speaking out. And that's just kind of how we've always lived our life. You know, but I'm not going to lie, there were some weird things. You know, it's a little awkward when a camera crew follows you to your first real high school dance and things like that. So
Really? Yeah.
it had its moments.
Yeah, of course. Well, it's amazing what you do now. So thank you for that. And I appreciate you supporting the community with the questions that will probably be coming your way now. So thank you so much for expanding on that. And if anyone has just joined and has any questions for Elizabeth, she is the patient advocate at Lifeview, which is part of Genomic Prediction. I know you're on that account now. And she'll be able to point you in the direction of support for any kinds of questions or further information about genomics, genetic testing.
Absolutely.
All right. Lovely to speak to you today.
Thanks so much for having me.
Thank you for everyone joining. Bye-bye. Bye.